Now that's a tough question because I do not have intimate knowledge of the breakdown of the NHS budget. Obviously, it's about 150 billion US dollars if I'm doing the math right. Now, I will say this. When you look at a global number, largely consistent metrics are as follows. Even in the most efficient healthcare delivery system, which US is not, and I don't think UK is either, you have at best an 85-15, 87-13 breakdown, meaning at least 10 to 15% of the spend is on purely administrative cost, meaning money we spend not on delivering healthcare, but managing healthcare. Arguably, every dollar we spend not on delivering healthcare in a purely frictionless model would be redirected to spending healthcare. So can we argue that 15% of 127 billion, so about 20 billion pounds a year, are costs that we should trim down and reduce it? Yes, that's a very plausible argument. Is it achievable to a zero? No. Will it ever go to zero? At least I don't foresee that. But can we bring it as close to zero as possible without compromising quality of care and access to care? Yes, we should strive to do so. Now, in some programs, like in the US, certain programs, admittedly, the percentage of administrative cost is 15, not 15, but 30%. And those are right. You want to go after those, because why would we spend 30 cents out of every dollar not delivering care? And that's just nuts. That's crazy. But that's what we have to do. Not because somebody just wants to burn the money, but because you have regulatory, process, participant, and social and economic conditions that drive this massive overhead. That's what we focus on, and we think we make a real dent there. In general, my personal view is that healthcare, when efficiently delivered, should not cost more than financial services cost. When you go buy a goods in a supermarket and you pay with your credit card, to the merchant, the transactional fee is not 30% of the cost of groceries. It's in the 1.5 to 3%. I mean, and 3% gets to be painful. But in healthcare, we easily spend 20-30% on that same transaction equivalence. So clearly, we can save significant dollars or pounds. Can I put a number to a percentage-wise? I can't, because whatever I say will be speculative and will be clearly challengeable. But do I think that the percentage that can be reduced from double digit to single digits, that's always there. I haven't met a healthcare system, whether it's Asia or US or Europe or Canada or Middle East, where the non-care component wasn't clearly in the double digits. The second part of it is the clinical care. So, okay, we are spending 85% of our dollars on clinical care. Is it effective? Are we really delivering the care for what we are charging, whether it was in terms of avoidable procedures or in the context of did we really need to prescribe this when we could have prescribed that, or did we really need to do this test twice? Did we really over-admit them? Did we keep them too soon, discharge them too soon, or keep them too long? Those are all clinical efficiency questions. So yeah, we are spending the money on clinical care, but is it really working as well as it should? And that efficiency, again, is easily attributable to a similar number. 15-20% of the clinical care is easily attributable to we could do things better, by better care guidelines, by better care coordination, by better care protocols, and so on. So no doubt that no matter how efficient healthcare system is anywhere, it always has room for significant improvement in terms of value received for money spent. And then there's a third bucket, which is fraud, waste, and abuse, right? And primarily around intentional abuse, where we have people either charging for services they didn't deliver, or charging too much for services they delivered, or delivering services they didn't need to deliver. And those scenarios exist in, again, every healthcare system. So I'm giving you a long answer to a short question. You're looking for a percentage answer. My answer is, depending on the bucket that we're dealing with, there's always 10 to 15% of the spend that is easy target for us to say, now that spend can be cut in half or more, but it will depend. So I would say the NHS in a nutshell, or Medicare or Medicaid in the US, they all are looking at double-digit savings opportunities.